Good morning, everyone, and welcome to day 2 of NAMI California's 2021 annual conference. I am Jessica Cruz, the CEO of NAMI California, and I just am here to welcome you all. We had a wonderful first day yesterday where we heard from our director of the California Health and Human Services, Dr. Mark Galley, and also Stephanie Welch on what the state is doing policy-wide on their investment to mental health. We also were able to hear from amazing plenaries on our psychiatric directives, state hospital work, ACEs, and some issues on housing and homelessness. Following that, we had some wonderful workshops. So I hope everybody was able to get something out of yesterday. Today, we have another amazing day planned. In just a few short seconds, we're going to hear from a special message from one of our top state leaders and a state of the state from our board president, Pat Courneya, along with an inspiring story from Dave and Marla, who will be able to share their own personal story and hopefully some hope with all of you. So I want to kick it off and officially welcome you all to the 2021 Day 2 NAMI California Annual Conference.
Hey everybody, it's Governor Gavin Newsom here, and I'm grateful for the chance to welcome all of you to NAMI's California 2021 Annual Conference. In California, as it should be the goal of every state, it's to give each and every individual the opportunity to thrive and be part of a healthy, equitable community. And we know that this mental health crisis touches all corners of our state and our nation. And our California Comeback Plan takes on mental health by transforming, quite literally, we're proud of this year, transforming the behavioral health system for children and young people, supporting vulnerable and homeless families, and building an age-friendly state for older Californians, as well as providing care for the most marginalized. Investments that are unprecedented in California history. This transformation, its aim, its goal, our collective aim and goal is to strengthen our critical safety net and programs to advance mental health and well-being for all Californians, as well as social and economic mobility. So I want to just thank you, NAMI California, for your extraordinary partnership, for your leadership, for your commitment and faith and devotion to the work that we all have in front of us to advance new treatments and new trends in mental health care. Your advocacy has been foundational to help ensure that California is as safe and supportive environment as any state in America for folks with mental health needs. So I hope you enjoy the conference, and thank you again for your leadership, as well as having me here just to say a few words. Enjoy.
Well, good morning, everyone. Welcome to day 2 of NAMI California's annual conference. I love the way the governor used words like unprecedented and transformational in his comments, and I think that these have been unprecedented and ultimately driving transformational change, which is exciting. My name is Dr. Pat Courneya, and I have the honor of serving as president and of the NAMI California Board of Directors. And I'm excited to share some details with you today about a very challenging year, and one in which NAMI can be very proud about our contributions here in California. It's a year when NAMI California and the wonderful affiliates rose up to meet those challenges. Next slide. You know, at this time of year, we all thought we would be back together in person for this conference. So much for that. A lot of things have happened since then, and we have more hope now than ever that we can see a light at the end of the tunnel. One of the most important things we've all seen and experienced is the remarkable upswing in mental health needs that have been present throughout the pandemic, with increased isolation and anxiety really acting as a catalyst in those who may be vulnerable to mental illness. Further, we know that as the pandemic begins to subside, we are seeing a large amount of interest in mental illness that NAMIs across our nation will be called upon to assist with in the coming year. We at NAMI California stand ready to continue to do our part to make sure that we continue to meet these challenges head on and make sure no one is left behind in getting the help they or their loved ones need. Throughout the remainder of today's presentation, you're going to hear some of the ways that NAMI California worked to adapt and rise to the many challenges brought on by COVID-19. But most importantly, it's how NAMI California continues to find new ways to be there for those who need us now more than ever. So, highlights and achievements. Let's talk a little bit about our programs and services in the fiscal year of 2020-2021. Last year, NAMI California continued to push hard to provide training and resources to the affiliates and communities that they serve across the state. In this year, for example, we met 100% of all requested training needs from our affiliates, providing training to over 307 trainers and facilitators through NAMI California signature programs. Over these past 12 months, NAMI California's team continued to be in close contact with our affiliates statewide through Zoom meetings to provide technical assistance and to learn even more from one another as we move through this prolonged and unprecedented time. Our programs in California exist as a partnership. And for us at NAMI California, that means getting resources out to the communities that need them. This year alone, more than $900,000 in direct support has gone out to our local affiliates to promote programs and to provide employment to NAMI members and their families. With the passage of the Peer Support Specialist legislation, NAMI California wasted no time in making sure that the communities we serve were leading the way in being employed in these critical roles across the state. Today, I'm proud to share that this year, NAMI in California has employed more than 100 peers in full-time work. This is a milestone achievement and one we expect to build on over time. Next slide. In addition to employing so many folks, we also have our eyes set clearly on the future and on the pipeline to both creating and training leaders across the state. Throughout California this year, we've launched recruitment programs spanning across social media and in partnership with our affiliates. We have recruited hundreds of qualified candidates who want to become peer support specialists and help change the mental health care system. We didn't stop there. This year alone, we've trained more than 200 new leaders throughout our state and doing it through our state training programs. And we are now ready to fill paid or volunteer positions across California. Next slide. Our NAMI on Campus high school program has continued to grow. Through the pandemic, we continued to reach out to schools and get them involved in getting support out to students, those in need across California. This year, we held trainings virtually for students and faculty to effectively meet them where they are. We also updated NAMI on Campus High School as a program to be more accessible to student distance learning realities throughout the COVID-19 pandemic. This includes updates to the startup process, as well as hosting trainings. Updated NCHS trainings included a virtual format for schools across California so that they could interact and learn about mental health and creating a sustainable NCHS club. This year, we trained schools from across the state who are providing support and education to their schools virtually, ensuring NAMI's influence and resources are reaching those who are the most in need. Despite the challenges that came with the pandemic, NAMI California has continued to receive interest from schools across the state, and we will continue to do everything in our power to keep NAMI's programs at the forefront of youth services. Next slide, please. If there's one thing we're not known for at NAMI California, it's sitting on our laurels. Although we've had an incredibly successful year, we are working with partners on new and innovative ways to reach and help those in need. In the coming months and years, we will have more to share about these impactful partnerships and the ways in which we hope to continue to improve the care delivery system in California that NAMI is such an integral part of. Next slide, please. Shifting to community engagement now, let's talk about how NAMI California has worked this year to engage communities across our great and diverse state. Next slide. On Wednesday, we were honored to host our annual Multicultural Symposium to much success. We were honored to have Dr. Sergio Aguiar-Gaxiola, Professor of Internal Medicine and Director of the Center for Reducing Health Disparities, as our keynote speaker. Although we were physically separated again this year, we were happy to be together virtually, to learn from each other, and to find new ways to connect to the communities of California. We were really proud of the event, and we hope you were able to join us. If you weren't, the entire event will be available on our website in a couple of days. Next slide. In keeping with our important work around connecting statewide and local leaders in important dialogue this year, we launched our Town Hall series. As you can see from this slide, we were incredibly fortunate to have leaders from across industries and areas of expertise come and share their important work and insights with us. Throughout this year, we convened these important dialogues not only to hear from the experts, but also so they can hear from our families about what matters and how they can use their important work to move California forward. If you want to learn more about any of these events, you can go to namicalifornia.org. That's NAMICA.org/town hall for more information. Next slide. A few last key highlights to show here. At the NAMI California office, we're always looking for new ways to bring people in, hear their experience, and connect them to decision makers. Maybe more than ever, that connection and convening has been of critical importance. As you can see here, over 300 participants showed up for Advocacy Day. 1,400 town hall participants were connected to our work in 38 different counties, and more than 1,000 participants in surveys and focus groups were part of the insights that we gather and share and learn from. Next slide. A little bit about this year's annual directors elections. This year's adjusted voting period was May 26th to June 24th. I want to give a big thanks to everyone who participated in the election by casting a vote or allowing your vote by proxy. Our 10% quorum of 3,996 active members was exceeded with 538 valid votes. It is a policy of NAMI California that the recruitment of directors is a continuous shared responsibility between members, employee partners, and current board members. It's not only our policy, but our practice to seek candidates who will provide, over and above all, positive contributions in a combination of the necessary skills, background, and qualifications to make the NAMI California board do its best work. Also, in an effort to ensure a level playing field, we follow our no campaigning policy. This year, the nominating committee approved 1 incumbent and 3 new candidate applications. So, without further ado, we are excited to announce, congratulations to NAMI Fresno's Chris Roop on her re-election to the NAMI California Board of Directors, and election of incoming directors, NAMI Tri-Valley's Laura Gregorio, NAMI Sacramento's Dr. Robert McCarran, and NAMI Alameda County South's Dr. Stuart Butler. If you've not already had a chance to do so, for a limited time, you can still view each candidate and their video on the NAMI California website voting page. Now, on behalf of the NAMI California board members who have joined us virtually today and everyone who's participated in their by casting their vote, congratulations, Chris, Robert, Stuart, and Laura. I look forward to serving beside you, be it virtually or in person, on the NAMI California Board of Directors in the months to come. Thank you all. This brings us to the end of our 2020-2021 annual update. As you've just heard, over the last hour, we've had another incredible year together while facing many ongoing challenges. Although what we covered today touches only the tip of the iceberg in terms of the work we do at the state office, we hope it gives you a glimpse into our efforts to change California for the better with your help. A special shout out to all of our wonderful affiliates who make up Team NAMI. We could not do it without each of you, and we look forward to working closely over the next year with you to continue providing wholehearted support and services we are known for to the families and individuals throughout our state who are impacted by mental illness. Again, we want to thank each of you for taking time out of your day to attend this wonderful annual conference.